Thank you very much for the invitation and to share some of our latest work using UK Biobank imaging data for non-invasive population phenotyping and to quantify measures of aging. I'm a radiologist, and what we basically do in radiology all day is to look at images and rule out or confirm a clinically suspected diagnosis based on specific features in the scan. Besides these, let's call them traditional features that we use to establish a diagnosis, every scan contains a lot more information that we perceive on a rather subconscious level and do not use to make a diagnosis, but it tells us something about the overall condition of the patient. Maybe a little bit similar to if you look at a person on a subway, you get an immediate impression of whether the person looks healthy and energetic, tired, or sick. And such an impression is usually not based on a single feature, but rather a holistic impression of the entire person, or translated to radiology, the entire imaging study. However, because this information is somewhat tricky to quantify, we usually do not use it in clinical routine and don't report it in our reports. So one question that I was carrying around with myself for a long time was whether there actually is a way to somehow quantify this information. And during my time in the US, I ran into a data scientist to whom I popped this question, and luckily for me, he was interested, and we started fiddling around for a while. And in the end, came up with a pretty simple solution. We trained a deep learning model in a cohort of healthy screening individuals, and the only input to this model was a single simple chest radiograph image, as you all know it. And the question that we asked the model to solve was, how old is this person? The output of the model was a number in years that we called chest X-ray age, with the assumption that this chest X-ray age captures an overall health status or biological age estimate of the person based on changes of the anatomy present in the scan. To see whether the quantified information was of any value, we then tested the model in two held-out independent testing data sets of more than 45,000 individuals not seen during any part of model development. And what we saw is that the model actually robustly stratified between apparently biologically younger and older individuals, and that there was an association with mortality independent of traditional cardiovascular risk factors. So that is the basic concept, and we validated this in different clinical scenarios and found relatively similar results. One question that came up early on in the process was whether we could do something similar using 3D imaging data like CT or MRI, and whether that would help to be more accurate due to the richer input data. And this is where the UK Biobank comes into play. As a first step, we had to make the data accessible. And what we did is we trained another deep learning model that takes the entire MRI scan as input and then quantifies different measures of body composition, such as muscle mass and different adipose tissue compartments. To get the largest data source possible, we not only did this in the UK Biobank, but conducted a joint analysis using data from the UK Biobank and the German national cohort, which totaled to, back in the days, more than 66,000 individuals with a broad age range between 30 and 80, which gave us a solid basis for a bunch of downstream analysis. And we started with a pretty simple descriptive approach, just to learn about the distribution of the different body composition measures and how they differed with increasing age decades and male and female. And what we found is that each of these measures showed a somewhat expected and predictable distribution with increasing age and between sex, such as increasing adipose tissue compartments and decreasing muscle mass. In the next step, we were interested in how the different body composition measures together changed with increasing age and between sex and how they relate to each other. And what we found is that subcutaneous tissue, which you can see here in blue, was the most stable compartment throughout the lifespan, and that men showed a much more substantial change in body composition than women, from a muscle-dominant phenotype in younger ages to a fat-dominant phenotype in older ages. In addition, we were also interested where along the C-axis or the vertical axis of a person the different body composition measures were predominantly present, meaning rather in the chest or rather in the abdomen and pelvis. And I tried to illustrate this with this little guy here. T1 on the x-axis refers to the first thoracic vertebra, and IT to a landmark on the upper thigh, and the different shades of color to the different age decades. And what you can see is, especially for the adipose tissue compartments, that there is a redistribution along the z-axis with increasing age for subcutaneous tissue, again in blue on the left, for example, from the pelvic regions in younger age groups toward the chest in older age groups. Finally, we calculated z-scores and percentile curves for the different body composition measures and adjusted them for age, sex, and height because these are the biggest known confounders of body composition. And what we saw was relatively similar to the distribution plots I showed you earlier. There was relatively little variation for subcutaneous adipose tissue, a slight increase in visceral adipose tissue, especially in men, and a continuous decline in muscle mass along with an increasing myosteatosis, indicating a constant decay in muscle mass and quality with increasing age. So that was a quick summary of the descriptive analysis we performed. The next question we were wondering about was whether we could use this information in a more clinically meaningful way. And coming from the clinic, when I look at these curves, they remind me a little bit of pediatric growth charts, where you want to see that the growing child follows its percentile trajectory and doesn't show a percentile drop, because this might indicate that there's something wrong. So similar to this concept, we asked the question, what does it mean if someone shows a deviation in body composition compared to an age, sex, and height matched peer group? So not landing in the middle of the curve, but rather on the upper or lower edge. And what we found is, for different incident clinical outcomes, that individuals with a deviation in body composition were at increased or respectively decreased risk to experience the outcome. And here you can see this, that individuals with high amounts of subcutaneous adipose tissue are at increased risk to develop future diabetes. Individuals with low muscle mass have a higher risk to experience a cardiovascular event. An individual with high muscle fat have a general high risk for all-cause mortality. And these associations are independent of traditional cardiovascular risk factors. So this was a quick exploration of MRI-derived body composition in the UK Biobank. And as a final step, we are currently in the process of trying to implement the approach that I introduced at the beginning of the talk for the chest X-ray study for MRI images. So instead of using the MRI and quantify the different body composition measures and then use them for further downstream analysis, we're now using the MRI as a direct input to a prediction model, and similar to the chest X-ray study, ask the model again, how old is this person really? And the output of the model is again a number in years, now an MRI age or biological age estimate. And our preliminary analysis indicate that there actually seems to be an association that a higher or older MRI age is associated with incident cardiovascular events. And as you can see on the right, this association is independent from a bunch of traditional cardiovascular risk factors. So this concept is still in its infancy and we have to investigate it further, but we hope that we can confirm and validate these results and then transfer them to other tissues and organs of interest to learn more about organ-specific image-based measures of aging. And with this, I conclude and thank you all very much for your attention.